name 4 medical uses of X-rays for diagnosis and treatment. So X-rays can be used to diagnose, that is to look inside the body and see what the problem is, see what the disease or condition is. And they can also be used to treat a condition, to try and make it better or even cure the person from that condition. So first of all, let's take a look at 2 parts of the body which can be diagnosed using X-rays. So, X-rays can form images of bones on photographic film. So here we go, X-rays can form images of bones on photographic film. And that's useful for seeing fractures in bones, for example, and it's also used to look into the health of your teeth. So it can diagnose dental problems such as tooth decay or cracks in a tooth, for example. So I'm going to put a D for diagnosis here. So there's D, diagnosis, and here's another D for diagnosis. And here's another D for diagnosis, which is called a CT scan. A CT scan, which is short for computed tomography. Computed tomography scan. What does that mean? Well, computed means that we need computers to process the images that are created by using X-rays, and tomography means slices. Now, what happens in CT scans is that X-rays are aimed at different angles through the part of the body that we're interested in, and we detect those X-rays using a charge-coupled device, or CCD detector, which we've talked about on another flashcard. That's like a photographic film, but an electronic version. And the electronic images that produces are then processed by a computer to produce virtual slices of that part of the body without actually cutting through the body. So we can actually diagnose and see if there are any problems, perhaps any cancerous growths or problems in the body. So that's a CT scan. Now that uses quite a lot of X-rays, and as we'll see in a moment, that can mean a high dose of radiation for whoever is being put through the scan. A treatment that X-rays can offer is called radiotherapy. Radiotherapy. And one property of X-rays, which is very similar to gamma rays, because they're at that far end of the electromagnetic spectrum, is that they are ionizing radiation. So we can say that X-rays are ionizing radiation. And that means that they can knock electrons out of atoms, and they can actually kill living tissue. Now, that can be a good and a bad thing. In the case of the CT scan, we want to keep the dose of X-rays to a minimum because we don't want damage of living tissue. In radiotherapy, we can use the ionizing properties to kill cancerous growths or cancerous tumours. So we can kill cancerous tumours which are at or near the body's surface. So we can say kill cancerous tumours near the body's surface. We can actually aim those X-rays at the tumour and kill those cells. We've got to be careful, of course, that we don't kill healthy living tissue around that. So there are four diagnoses and therapeutic uses of X-rays. We've got the two-dimensional photographic film for fractures of bones and dental problems, and we've got the more sophisticated computed tomography scan, which gives us virtual slices through a body part. And we then have a therapy that's to try and help cure a disease, and that's where X-rays are used to kill cancerous tumours near the body's surface.